Jakob, you're one of the most famous health economists in Denmark. You're also consulting the government, and you wrote a white book. Can you explain Swiss people in a few sentences what is in this white book?
The new white book basically describes the reform of the healthcare system from now on and onwards. I didn't write it myself. It was a big group and there was a big secretariat, but it is a process that we use in Denmark when we have major reforms that we are going to overcome, that there will be a group of people, often experts in the field, who have been given the opportunity to basically relatively freely write what is needed for the healthcare system, of course in a political context, and then it's given to the ministry to say, how can we use this in the reform process? And this time round, Denmark was the big challenge is basically we have so many elderly because of the demographic change, so we cannot continue treating people in hospital in the same way. So we have to build a stronger primary care sector, and that creates some structural changes in our system that will cap the number of doctors in the hospitals, will channel more money to GPs and practicing specialists outside the hospital sector, and we will use a lot of mechanisms basically to be able to transform and change the directions to meet the future needs of the population.
We have, in Denmark, we have 3 levels. There's the state level of the whole country, and then we have several regions, and then the municipalities are also playing an important role. Can you tell us a little bit about it?
The political stronghold in the country is the parliament, the central parliament. Then we have regions, then they're running the healthcare sector, or especially the hospital sector, but in the future also more emphasis on the primary care. And then we have the municipalities providing care for the elderly mostly, but also running the schools and so onwards. And sometimes these structures, they need to adapt for the future change. And what we have seen over time is that if we go back 50 years or so, we have 1,000 municipalities and 14 counties. Then we changed it back 20 years ago or 15 years ago. And then many times since that we now have 100 municipalities and we have 5 regions, and in the future we'll only have 4 regions. So we changed the structure according to our needs, and we changed where the tasks are. We will take some of the healthcare tasks from the municipalities to the regions and acknowledge that some of the tasks are too specialized today to have them decentralized to so many units. So basically, structure is an organic thing in Denmark, that we are actually ready to change things if we need change for the health of the population.
And which professional will be the most important one in this future?
Well, all the professions are really important. Doctors always play a major part, but our key challenge is actually nurse assistants, because we can see we train a lot of doctors and we have a good supply of them. They just have to be distributed slightly different. But when we have such a demographic change, we'll need much more staff being able to take care of the patients when they're not in hospital, that is at home. We also need to be able to transform our healthcare system to provide more services digitally in people's own home. So lots of services and staff surrounding the capacity building of the healthcare sector outside of the hospital. That is what is needed. And it's not just doctors and nurses, but it's also lots of other healthcare professions and IT specialists, etc., etc.
Okay, you talked about digitalization in this system. Will elderly Danish people have robots at their home?
Robots, we already have some kind of robots for cleaning, and how the future will be in 10, 15 years, it's very difficult to predict. But there's no question that we will decentralize healthcare. And if it comes by robots or it comes by by other intelligent sensors looking at the patients in their own home, or however the future plays out digitally, is very difficult to predict. But we know the direction of the healthcare system will be more digitally. So we have to have an infrastructure and a backbone in the healthcare system that is able to adapt to these changes. Maybe it will be robots, maybe it will be something else, but the backbone of the system have to be able to deal with all the technological changes we'll see in the future.
And what will be the biggest challenges? Is it the financing of the system? Is it the professionals of the system? Or is it the quality of service of the system?
Well, there are lots of challenges, but I think in many ways we're reasonably on top of many of them in Denmark. We're lucky that we have a strong economic situation right now. And we also look at the staffing at doctors and nurses seems reasonably okay. But the major challenge will be the staff for the assistant nurses and taking care of the elderly at home. That will be a huge challenge that we haven't solved so far. The other things we'll probably be able to deal with, but we cannot really deal with that we're lacking thousands and thousands of staff members who are supposed to take care of the elderly in their own home. Here we have to think radically new ways to deal with that.
And you will need more professionals, or do you need less professionals?
We don't need to educate and train more doctors. We actually have a strong supply there, but we need to make it attractive for the youngsters to seek a profession within elderly care. Otherwise, the service will be much lower than it is today.
Will it be more medical or more social services?
Well, I don't think you can really look at services like medical and social services, because in the past, we provided a lot of services in the healthcare system that was on the borderline between medical and social. Today, the system is more tight. So the patients or the citizens who get services in their own home, they are often sick. So it's a little bit of a strange thinking, saying sometimes they're citizens, sometimes they're patients. They're citizens all the time, but we have to take care of the healthcare needs.
How about teamwork in the healthcare system? Which do you consider teamwork as well or very well? Or what could be better in teamwork in Denmark?
We need to be better all the time. I don't think it's really poor, but there are often some barriers for saying that some unions have some rights. Doctors have the right of prescribing pharmaceuticals. In some situation, it would be easier if nurses, to a bigger degree than today, could prescribe some of the more basic pharmaceuticals. So the way of thinking, how do we use the resources collectively better, is important, but there are also, and that is also a way of thinking about teamwork, to pool the resources to achieve a greater goal together. And sometimes there will be some give and take, and sometimes that is of course difficult when you have some historic rights to have a monopoly of some services.
And are the differences between health services here in the metropolitan area of Copenhagen or on countryside? Are there big differences, or is it the same for all the people in Denmark?
Well, unfortunately, the differences have been growing over the last 20 years. There will always be differences in what you can provide in a big city. A hospital will always be closer to your home when you are in a highly urbanized area than in a rural area. But what we can see over the for many years now is that richer people live in the bigger cities. That wasn't like that 30 years ago. It was more evenly distributed, the wealth in the country. And people with lower income live in the outskirts of the country. And we haven't been able to transfer the healthcare resources accordingly. So now we have a great supply of healthcare services to young, rich people in some of the big urban areas, and too little services in the rural area. And that's what the healthcare reform really have to deal with, is to equalize the need and the service provision in a more meaningful way and more sustainable way than it is right now.
And how about the collaboration between the public sector of a healthcare system and the private sector of the healthcare system in Denmark?
Well, most of the healthcare system is public, but we embrace public-private partnership. If we look into the digitalization process, well, it's managed by the public, but it's provided by the private. If we look at GP services, it's also private enterprises providing the services. And we also have private hospitals, but a relatively small sector. We have nothing against the private sector, but we have a very pragmatic way of looking at it and see if you can deliver the best service at the best price, then personally at least, I don't really care if it's public or private.
Thank you very much. We are looking forward to see you in Bern in January.
Thank you very much.